Hi, my name is Samantha Nicole, and I am the creator of New York Cosmetic Surgery Information Network on Facebook. I'm also a Beauty Council member, as well as a patient of Dr. Vandegrift. I recently had a labiaplasty surgery, and we're here today to discuss. I'm here with Dr. Meredith Vandergrift. Thank you so much for joining us today. Tell us a little bit about yourself.
Thank you for having me. So I'm a board-certified plastic surgeon, Vandegrift Plastic Surgery here in Huntington, New York. I'm in solo private practice, and this is my new location, and I'm excited to be here with you today.
So first and foremost, what is a labiaplasty surgery?
So labiaplasty most commonly is a surgery to reduce the size and the shape of the labia minora. Now, it can include also the majora, but 99% of the patients that I see are coming in for elongated, enlarged labia minora.
Can you tell us a little bit more about what the procedure entails? How long is the procedure? What's the recovery time? Things like that.
Sure. So one of the great parts about this procedure is that I do it almost exclusively under local, so we don't have to worry about general anesthesia and recovering from that. So my patients come in. We start the process with a little topical numbing cream so that when I do the injections to really get the area numb, you're not really feeling it. You're comfortable, as you experienced. And the procedure itself takes me about a half hour. I tell my patients plan on being here about an hour to an hour and a half. Just so that we make sure that you're nice and comfortable and okay to drive home safely, which most patients do drive themselves home, which is also another perk.
Can you tell us a little bit about the different methods of labiaplasty surgery?
Sure. So there are two main types of labiaplasties. I do both more commonly. So there's the wedge, which is the one that was the more traditional way that we were taught in training to do. And then a newer technique called the trim was evolved. And I actually do that the majority of the time. In my hands, I find I get the most reliable results, the best symmetry. It's the safest in terms of wound healing. And I think that, taking out the dark outer edge of skin is also a cosmetic concern with a lot of my patients. And the trim does that. It removes that outer dark skin that most patients don't like. So that's the most effective way to do it.
This is true. And what would you say the recovery time altogether is? When can people return to work and working out and sexual activity?
So for the first 2 days, I recommend that my patients just take it easy, stay rested, keep the pelvis elevated to help minimize swelling. You'll be icing this time, 15 minutes on, 15 minutes off, as much as you can. And just generally, going slow and low. After that time, you can generally resume your normal activities. I do request that my patients not do any physical workouts, going to the gym for 3 weeks, because that's the main healing time, which I know is hard for a lot of people, but it goes quickly.
It does.
No tampons and no sex for 4 weeks, though. And then the follow-up is I see you at 1 week post-op and then at 3 weeks post-op.
This is all true. Now, would you say there is a typical demographic of women that you see for this procedure, age range?
No, I treat teenagers. I have young women being brought in by their moms who weren't really aware that this was an option for them, up into women in their 60s who, again, this wasn't something that they thought was even a possibility. So I see it the full age range, which is really cool.
Now, why do you find that this is an option for women of all ages?
I think number one, grooming changes over the last, several decades. I think, 50 years ago, women weren't getting waxed like we do now. So I think there's just an awareness of our anatomy. I think that women have more agency now, and we feel more comfortable to say, hey, something doesn't feel right. Something bothers me. Let me see if there's something that I can do to fix that. And I think that the fact that we have Google and things like that, there's so much information. So it's just out there.
I actually found out about this procedure about 10 years ago, and I had been researching it for a very, very long time. And, I feel like I would like to bring a lot of light to this topic, which is why we're doing this interview today, because a lot of women are embarrassed and they're not comfortable with discussing this. And I myself even thought that, I would never talk publicly about this, right. But really it's not a big deal. And the more that I talk about it, the more I find that there are so many women suffering from the same issue from all ages. Absolutely. And there's so much more information about this procedure today. And I really hope that we can bring a little bit more light on it so that more women can feel comfortable coming forward and saying hey, I want to take care of this also. It's really such a comfort issue. And that was the main reason why I did this. And it has been a comfort issue since I'm a teenager. So I know that, now that I've had it done, that I'm so mad that I waited 20 years. And I'm so glad to have found you. So, thank you so much. It's honestly going to be life-changing for me. I'm so happy. So let's talk a little bit about some of the ideal candidates for this surgery. Like, what are the most common types of women you see coming in here? What are the most common problems that they describe?
So most of my patients complain of a functional issue. There is uncomfortableness wearing certain types of clothing, bathing suits. They complain of chafing, irritation there. They have trouble with intercourse. The tissue actually just is in the way, and so it can tear during sex. It can just be difficult to manage. It's a source of embarrassment in certain clothing, especially my swimmers and things like that, my gymnasts. So it's really a major functional issue. And then there's some cosmetics involved too. I mean, we want to look pretty in our entirety, our whole body. And I think that, it's always been accepted, bigger breasts or firmer breasts are, the way to be, and that's beauty. And we don't really talk about our vulvas and how that's also something that we want to feel pretty, there too. So.
It's so true, because although for me it has been a functional issue for such a long time, the cosmetic benefit is,
it's a nice
it's a bonus.
Absolutely.
Absolutely a perk. What would you say some of the most common stigmas surrounding this type of procedure are?
I think that there is a bit of a misconception of what we're doing and why. I mean, for me, it truly is mostly the functional part. I think that, in some cultures there's, an association with misogyny and having surgeries more to remove pleasure for a woman. And that's certainly not what we're doing here. We're doing something to hopefully increase your pleasure.
That's true.
But, other people, GYNs, will tell you that this is all a spectrum of normal anatomy. And that is true. But then again, if you look at it that way, so are small breasts that we augment. So are overly large breasts that we reduce. So it's a spectrum of normal, but that doesn't mean that you're comfortable and it's, working for you.
I think the biggest part of this procedure is really realizing that you're doing it for yourself and not somebody else. Like any plastic surgery or cosmetic procedure, the most important thing is having the right intention behind it and knowing that it's for you to make yourself feel better for whatever that reason is, whether it's functionality or cosmetic. A lot of people think, they're doing whatever procedure to, make themselves look better for other people, but it's not true. Like everything that I've ever done for myself, including this procedure, has been for me. And, I want to help other women realize that, it doesn't matter what anybody else thinks. You just got to do what's best for you.
Right. And that's with everything I do. I mean, I think, obviously I ask my patients what their motivations are. And I think with any surgery that I do, it has to be because you want to feel better about yourself. That has to be the major driving factor. And I love to be able to do that for women.
This procedure was so unbelievably easy, and I think that I was more nerve-wracked going into it, and not knowing what to expect. But I took a little something to relax before I got here. My mom drove me, but you do have the option to drive yourself to and from. But I chose to have my mom take me. But I came in. I was administered topical numbing within a couple minutes after that. Dr. Vandegrift did a numbing injection on either side, and the procedure was 30 minutes. During the procedure, I was working on my phone, booking appointments. We were laughing. I couldn't feel a thing. I went into recovery after that, had some crackers, and then I went home, and it was relatively comfortable. I kept my feet up. I did take a pain med later on that day. That was the only one I needed. And the following day, I actually wasn't in any pain. And I had never actually had pain after that at all.
Which is pretty common.
Yeah. I mean, I felt the sutures. And, I stayed out of work for 2 days. And, I mean, the swelling went down within a week. I'm just so, I can't even believe how easy this whole thing was start to finish. I was wearing jeans a week later, and I didn't even realize, I was out to dinner, and I was like, oh my God, my jeans don't bother me. Usually I am in jeans for 30 minutes tops because I'm like, oh my God. So, thankfully, I can't wait to put a bathing suit on.
I can't wait.
I'm so excited.
So awesome.
I was back to the gym in,
After 3 weeks.
2 to 3 weeks. So I've had a ton of plastic surgery procedures from both male and female doctors, and I did my research before having this procedure with Dr. Vandergrift, and I did consult with both male and female doctors. And for me, a very important thing is that I chose a woman, because the consult between a male doctor and a female doctor was so radically different. And I just felt so comfortable with you, and you just made me feel like, I'm not even kidding you, home. Like, I felt like this was the right place. It clicked. I was like, we're done. We're doing this. And, I'm so grateful. Thank you so much.
Pleasure. I think that, as a woman, I understand what bearing children does to your body, both what people can see and what only we see. And I think that experience helps me relate to my patients, and I think that helps you feel more comfortable, and it gives you a better overall, experience with the whole procedure, start to finish.
Absolutely. Thank you so much, Dr. Vandegrift. This has been a life-changing experience, and I truly, truly appreciate you. Thank you.
My pleasure. I'm so happy that I was a part of your journey.
No spoilers, but we're really looking forward to seeing a lot more of Dr. Vandegrift with Beauty Affair.